Welcome, everyone. And what I'd like to do today is all of you have the DVD. So I'm going to talk a little bit about the DVD and the Canadian guidelines. And so you have the PARMEDx for pregnancy in front of you. And I'm going to show you how to use this tool. How many of you are fitness professionals? Midwives? Awesome. And physicians? Just interested people in exercise and pregnancy. All right, this is great. So that's what I'm going to talk about mainly today is the PARMEDx for pregnancy. But before I get into that, what I'd like to do is to talk about the importance of a healthy lifestyle during pregnancy. It's extremely important with regards to the environment that the fetus develops in, so that it is a healthy environment. The mother should have a healthy lifestyle. And I'm going to talk about the historical guidelines for exercise during pregnancy before we came up with these PARMEDx for pregnancy guidelines. And this document that you have in front of you is actually available from this website, which is the Canadian Society of Exercise Physiology. And I'll talk about that in a minute. But this document is basically 4 pages where it has medical pre-screening, aerobic exercise guidelines, muscle conditioning guidelines, safety considerations, and then I'll summarize all of that for you in the end. And then I'd also like to leave you with other ways to be physically active. And of course, I'm going to promote the Move for Two DVD, which you have, all of you will have as well. So that's what we're going to accomplish tonight. If you have any questions at all, feel free to ask. And if not, then I'll take questions at the end. First of all, what I'd like to share with you is that there is a problem of obesity in the world. And in fact, this was from the National Geographic in 2004 that actually did a whole write-up on obesity and how it's a widening problem, no pun intended, across the world. And so, does it affect us in Canada? Yes, indeed. And in fact, we don't have as many statistics out there, but certainly from the United States, this is very interesting, that the prevalence of obesity in the United States, about 30% of adults above 20 years of age are now considered obese. That's about 60 million people in the US. And 9 million children or teens are overweight. So those are very sobering statistics, especially when you think about the health issues with regards to obesity. Obesity can affect all of the organ systems. It's a risk factor for high blood pressure, type 2 diabetes, from heart attacks, and even mental illness or dementia is also a risk factor with obesity. And not only that, but we're finding that many children are now obese. And those children who are obese actually have an increased illness. They are at risk for becoming obese adults. And they also have related health issues, type 2 diabetes and high blood pressure, even as children. And they have unhealthy lipid profiles that actually starts within childhood and progresses into adulthood. So it doesn't look very good for our population with regards to obesity as an epidemic. Also in the National Geographic, this was the cover, and it said, "Why are we so fat?" And it's interesting that when you take a look at lifestyle, there's obviously lifestyle eating habits versus sedentary or inactivity that come together that may potentially be an issue. But that doesn't stop at pregnancy. And in fact, maternal obesity, it's about 40% in our population. So that's about 1 in 6 women are obese coming into pregnancy, and 1 in 3 are overweight. And in fact, my obstetric colleagues and midwife colleagues would suggest that they see mainly overweight and obese pregnant women delivering, and it's very rare to see a normal weight pregnant woman delivering in hospitals today. So that's a very scary statistic. And in fact, obesity and overweight during pregnancy increases the risk for diabetes during pregnancy or gestational diabetes. Is there a pregnancy link to obesity? Yes, there is. In fact, among women of childbearing age, one potential pathway for obesity development is excessive pregnancy weight gain and postpartum weight retention. I can give you some statistics from June 2010 from Statistics Canada. They took a look at weight gain during pregnancy, adherence to Health Canada's guidelines. And what they found was that pre-pregnancy weight was a primary determinant of pregnancy weight gain. So what you weighed prior to becoming pregnant actually was a predictor of how much weight you might gain. And the women who gained more weight than recommended gave birth to a big baby of over 4 kilograms. That's over 9 pounds. And about 58% of those women gained more weight. And at 5 to 9 months post-delivery, those women who gained excessive weight during pregnancy had more weight retained. So that's about 4.5 kilograms, or about 10 pounds extra, that they did not lose after pregnancy. So there are weight gain guidelines that have been released by the Institute of Medicine in 2009, and that is the website. Unfortunately, it's red. I don't know why it turned red, but you can't read it. If you would like that website, let me know, and I can certainly provide it to you. But these are recommendations for total and rate of weight gain during pregnancy by pre-pregnancy body mass index. And so this is pre-pregnancy body mass index for underweight, normal weight, overweight, and obese women. And this is based on their body mass index. So normal weight women have a body mass index, or a weight divided by height squared is how you calculate BMI. They're about 8.5 to 24.9 kilograms per meter squared. And normal weight women are recommended to gain between 25 and 35 pounds. And if you look at the rate of weight gain between second and third trimester, it's about 1 pound per week. And overweight women, those women that have a pre-pregnancy body mass index of 25 to 29.9, are only supposed to gain between 15 and 25 pounds during pregnancy. And that's about a 0.6 pound rate of increase in weight gain per week in second and third trimester. And in fact, obese women, those women that have a body mass index greater than 30, are recommended to only gain between 11 and 20 pounds, with about a 0.5, half a pound increase per week in second and third trimester. So there are risk factors and a common link to chronic disease. And what I've seen is, in fact, physical inactivity is actually a risk factor for obesity, for gestational diabetes. And when you put all of that together, that has chronic risk factors for later in life, type 2 diabetes, cardiovascular disease, and also something called metabolic syndrome. So it seems to be the link here is physical inactivity. Now I want to share with you this little cartoon of maternal and fetal well-being. So this is a baseline of quantity and quality of maternal exercise across here. This is a maternal dose-response curve. So theoretically, if a woman is physically active during her pregnancy, you will see an increase in metabolic and cardiopulmonary reserves, so she will increase her fitness level. You see a promotion of normal glucose tolerance or sugar tolerance, and you see an increase in mental health. There is also a fetal and placental dose-response curve, so that in fact there are adaptations that occur when a woman is physically active that are beneficial to both placental development and also to the fetus. Now, we do know, based on scientific research here, that there is an optimum zone for maternal exercise prescription, and beyond which we don't know what happens. And so that's why we have a medical pre-screening form to make sure that every pregnant woman that exercises has no contraindications and has a low-risk obstetric pregnancy. So because of that, we have the PARMED X for pregnancy that I will talk about, because we know, based on scientific evidence, that these guidelines are actually healthy and safe for a pregnant woman to participate in. But one of the interesting things that we're finding is that right now it seems that our pregnant women are not actually doing enough. And so I talked about a threshold over here, which means that they might be doing too much, but I think there's also a threshold over here in which they're not doing enough, and in fact, we may actually start seeing problems with maternal pregnancy adaptation because they're not being physically active enough. And so we may start seeing now, with coming back to that link with physical inactivity, we may see now women who have gestational diabetes, women with hypertension because they're not being physically active enough. And in fact, we may also see potential issues with fetal development. So it all comes back to physical inactivity and a sedentary lifestyle. So maternal obesity and excessive pregnancy weight gain is linked to big babies. And in fact, excessive weight gain during pregnancy is also linked to childhood obesity. So the fetal environment is an important factor for growth and development, and lifestyle is extremely important. There is evidence now to suggest that that fetal environment is so important that, in fact, it can impact on the chronic disease risk of that baby in the future. And if you think about what happens in an individual who is pregnant that is obese and not having a healthy environment or healthy lifestyle, this is actually again from that National Geographic article, and it is an MRI which actually bisects an individual, and this is an obese woman compared to a normal weight woman. So we know that there are many physiological issues and problems related to obesity. So think about that fetus developing in that environment. And so this increase in fat mass may be accompanied by potentially glucose intolerance, insulin resistance, diabetes, and cardiovascular problems, not only for the mother, but potentially also for that developing fetus. And I want to share this little rat study with you. I think it's amazing. But what they found was that they fed their rats, pregnant rats, junk food. And this was heavily processed or hyper-energetic junk food during pregnancy and also during lactation. And they found that that may increase junk food preference of the offspring and may increase the risk for obesity in the offspring. Isn't that an interesting little study? So, healthy lifestyle then is a balance. It's a balance between what we eat, eating habits, and in fact, I'm sure you've all heard this, that now that I'm pregnant I can eat whatever I want. Not a good idea. So during pregnancy, it's not eating for two, but eating twice as healthy. And that's what I tell our pregnant women. Portion sizes is extremely important. And yes, if you're a normal weight woman, you should ingest a little bit more than what you did prior to when you became pregnant. But that little bit more is about an apple more per day. And so when pregnant women say, oh, thank God I'm pregnant, I can eat whatever I want, you need to remind them that, in fact, that's the worst thing they could possibly do. They still need to eat very healthy. And the other side of this balance is activity. And so if these women are not active enough, there may again be potential issues So I always show my little sedentary woman here with a line across it saying, no, putting your feet up while you're pregnant is not a good idea. So can we make a difference? The research in my lab is looking at preventing excessive weight gain. It's evidence-based research, and we have a program right now called Nutrition and Exercise Lifestyle Intervention Program, affectionately called NELIP. And in this research, we are trying to prevent childhood obesity early by an intervention during pregnancy and also during the postpartum period. And so if you're interested, we're looking for pregnant women who are less than 20 weeks and also after delivery with an infant less than 8 weeks old to do either a pregnancy or a postpartum nutrition and exercise program. So I've done my little advertisement for the day. So what are the guidelines? And what were the guidelines historically? Well, believe it or not, prior to 1985, there were no guidelines, and pregnant women were told to rest. In 1985, the American College of Obstetrics and Gynecology suggested that heart rate should not go above 140 beats per minute. This was not based on scientific evidence, and in fact, this haunts us to this day. There are many physicians out there who still believe that thou shalt not go above 140 beats per minute. It is not based on scientific evidence. And so this was so controversial that in fact, the American College of Obstetrics and Gynecologists actually ignored heart rate in 1994 and replaced it with common sense guidelines. And in 2002, ACOG again ignored heart rate and replaced this with exercise. Pregnant women with a low-risk pregnancy can exercise on all, if not most, days of the week. In fact, in 2008, the Physical Activity Guidelines for Americans is about a 35-page document, of which 2 paragraphs belong to pregnancy. And these are what those paragraphs say. So healthy women who are not already active or doing vigorous intensity activity should get at least 150 minutes of moderate intensity aerobic activity per week during pregnancy and postpartum, and this activity should be spread throughout the week. And the second paragraph is, pregnant women who habitually engage in vigorous intensity aerobic activity or who are highly active can continue physical activity during pregnancy and postpartum, provided that they remain healthy and discuss with their healthcare provider how and when activities should be adjusted over time. What does that mean? I don't know. I'm not really sure what that means. It really doesn't give our pregnant women guidance as to what they can do or not do during pregnancy. So in Canada, we've been a bit more proactive. We have developed a tool called the PARMED-X for pregnancy, and that means the Physical Activity Readiness Medical Prescreening and Exercise Prescription Tool. PARMED-X for pregnancy is the short form, and it was originally written for the physician, midwife, or the healthcare professional to increase the communication between the pregnant woman, the fitness professional, and the healthcare professional, the midwife or the physician. And so this document has also been approved by the Society of Obstetrics and Gynecologists of Canada and, of course, the Canadian Society of Exercise Physiology. And in fact, they did a joint clinical practice guideline statement endorsing this particular tool that we're going to talk about tonight. This tool has also been endorsed by the American College of Sports Medicine. And in fact, there's going to be a new edition, 9th edition, coming out with guidelines for exercise, of which one small chapter is related to pregnancy. And this has been endorsed by the Canadian Academy of Sports Medicine. It's used by Park or Ophea or CanFit Pro. It's used by the Middlesex London Health Unit in their prenatal classes. Other health units also use it. And of course, it's being used with the DVD that you have. Inside, you will find the PARMED X for pregnancy. And as Bernadette suggested, that the Move for Two DVD was launched on January the 19th, so last Wednesday was our launch date. And so we're very excited that now all pregnant women in London can have a free copy of this particular DVD with the PARMED X inside. There is another tool that if you're interested in, it's this little booklet called Active Living During Pregnancy that is available on the Canadian Society for Exercise Physiology website, but it costs about $12, and this little booklet was made for the layperson. So anybody can order it off the web, but it is specifically for the lay individual. But I'm not going to talk about that tonight. What I'm going to talk about is this PARMED X for pregnancy. So if you want to grab your PARMED X, we're going to go through it. And if you have any questions as we're going through it, please feel free to let me know. So this document that you have in front of you is a 4-page document. It looks at the current history of pregnant women and their occupation. And occupation is extremely important, and I'm going to talk about that in a minute. There is a list of contraindications to exercise, both absolute and relative. And there are aerobic conditioning guidelines, and that is based on the FIT principle. FIT meaning frequency, intensity, time, and type, and I'll talk about that in a moment. There are also muscle conditioning guidelines and precautions, safety considerations, reasons to consult the physician and midwife, and also reasons to stop. So if you take a look at page 1 is filled out by the pregnant woman. So she fills out this front page, and it's like taking a history. So if you are a fitness professional or a midwife or a physician, and your pregnant client or patient fills out that front page, it will give you important information about how physically active she has been. So let's take a look at the first page. So the top part of the page is actually instructions on how to use it. So I guess that's important. There's also a patient information area here in case it actually is through the midwife office or physician's office. And under Part B here, it says pre-exercise health checklist, and it says general health status. So it says in the past, have you experienced in a yes or no format, miscarriage, other pregnancy complications, and if you've answered yes, please explain, and the number of previous pregnancies. The next part after that is Part 2, status of the current pregnancy. So in this, during this, it says the due date, during this pregnancy, have you experienced any of these potential issues? Many women actually are very fatigued in first trimester, and so if any of these are checked yes, then it's important to ask her, but has this subsided? Because a lot of women in first trimester are not feeling well, they're throwing up, they're nauseated, and so it's not a good idea to have them start an exercise program if they're not feeling 100%. So it's always good to find out what they're actually doing prior to exercising. Also on this page, Part 3 here is activity habits during the past month. So you will be able to see how physically active this pregnant woman is. And it's based on regular fitness or recreational activities. She can list them. Intensity, heavy, medium, or light. Frequency in times per week, 1 to 2, 2 to 4, or 4 plus. Time in minutes per day, less than 20, 20 to 40, or 40 plus. So it gives you an idea of what she has been doing. And there's a question here saying, does your regular occupation activity involve any of these? And again, it's in a checklist format. Now, occupation is extremely important, especially if you're going to be prescribing physical activity. The reason is because, for example, if you are a nurse, if she's a nurse, and she works 12-hour shifts, she lifts heavy patients, runs up and down the ward, if you were to ask her, do you do any exercise? She would say, oh no, I don't have time to exercise. However, she actually is doing a lot of physical activity in her daily job. The same with a woman who has 3 or 4 children at home, all under the age of 5. If you were to say to her, do you do any exercise? She'd say, oh, I don't have time to exercise. But she's lifting toddlers, she's running up and down the stairs, she's doing laundry, she's doing a lot of physical activity that you need to know about before you prescribe physical activity above and beyond what she does during her daily life. So this is extremely important to find out what she actually does during her daily activity. And of course, smoking tobacco and drinking alcohol, I'm not even going to go there, but as you know, not a good idea to do either of those things during pregnancy. So the very bottom of the page says, what physical activity do you intend to do, and is this a change from what you currently do, yes or no? So this first page then gives the physician, the midwife, or the fitness professional an idea of what the pregnant woman does and has done before she actually is engaging in a physical activity program. Any questions about page 1? Pretty straightforward, right? Page 2. Shall we go on to page 2? So take a look at page 2. At the very top of the page, it says, Part C, contraindications to exercise, to be completed by your healthcare professional. So this is a medical call. It should be completed by the midwife or by a physician. Even nurse triage, people can potentially fill this out if they feel comfortable. But basically, at the top part, I'll talk about that in a moment, and then I'm going to focus mainly on the prescription for aerobic activity. So this top part here is divided into absolute contraindications for being physically active during pregnancy and relative contraindications. And the reason why it's divided into 2 like this is because if you have these absolute contraindications, chances are they will not change during pregnancy, and you may even end up on bed rest potentially. But if you have relative contraindications, for example, anemia, which I think is number 3 here, it can be changed. So a pregnant woman can actually have an iron supplement that could change that condition, and once it's been rectified, then her physician or midwife may potentially say, now it's okay for you to be physically active. So that's why it's on the relative list as opposed to the absolute. So on the bottom here, physical activity recommendation, either recommended or contraindicated. On the bottom of the page, we see prescription for aerobic activity. And what should hit you in the face here is FIT. The FIT principle, frequency, intensity, time, and type. And I'm going to go through all of these with you. But first, I want to remind everyone that it's very important for warming up and cooling down. So what that means is that an aerobic activity where you're moving large muscle groups should be preceded by slow rhythmic movement for a warm-up by about 10 to 15 minutes, followed by your activity, and then a cool down at the end of that. So the warm-up and cool down then is precedes aerobic activity, 10 to 15 minutes, followed by 10 to 15 minute cool down. And I'll talk about prescription for monitoring of intensity in just a minute. So if we look at the FIT principle, frequency, intensity, time, and type. Frequency, yes, once a pregnant woman has been medically pre-screened, she can start an exercise program. She can begin at 3 times per week and progress to 4 times per week. Intensity, I'm going to talk about intensity in a minute. Exercise within an appropriate rating of perceived exertion range or target heart rate zone, which I'll talk about in a second. Time, FIT, attempt 15 minutes, even if it means reducing the intensity. Rest intervals may be helpful. And the type of physical activity. non-weight bearing or low impact endurance exercise using large muscle groups. Walking is a marvelous activity, stationary cycling, swimming, aquatic exercises, low impact aerobics, or a Move for Two DVD. Frequency. I want to qualify frequency for you. We did a study a number of years ago where we looked at the impact of exercise and occupational activity on birth weight. And this study, we looked, questionnaires were mailed at 2 weeks post-delivery to individuals identified from delivery room logs. It was a case-controlled design. So the cases were women who delivered small for gestational age babies, and controls were normal weight babies. And we recruited 2 controls per case. And what we found was, with our 529 women that returned the questionnaires, with a lot of statistical analysis here, the odds of giving birth to a low birth weight baby was increased for those who engaged in structured exercise equal to or greater than 5 times per week. And that risk factor was about 4.6 times higher for those women who engaged in exercise 5 or more times per week. And also, the interesting thing was, for those women who engaged in structured exercise 2 or less times per week, there also was a 2.6 increased risk of delivering a low birth weight baby. We looked at duration, we looked at frequency, we looked at intensity, but what came back at us was frequency. So what we concluded from this little study was that structured exercise frequency during late pregnancy appears to be a determinant of birth weight. And there's too much versus too little versus just right. I feel like Goldilocks and the 3 bears here, but just right actually means about 3 to 4 times per week. So, based on these guidelines then, frequency begin at 3 times per week and progress to 4 times per week because we know that that is safe. So intensity then is also an important factor, and there are 3 ways that you can determine intensity, whether it's appropriate. On your PARMED-X for pregnancy, there is a little chart right in the middle there that says target heart rate zones. And this is based on age, and it gives you a target heart rate range. So say if you were a woman who is 25 years old and you wanted to start an exercise program, but you've never exercised before, but you've had medical clearance that you can start, then I would suggest you start at the lower end of the target heart rate range at about 135. If, however, you have been very active and you want to continue, then you could exercise maybe at the higher end of the target heart rate range. Now, these are based on the fact that pregnant women have an increase in resting heart rate from before pregnancy by about 15 to 20 beats per minute more. So that's why these target heart rates are lower than what you would see in a normal non-pregnant type population. So that's why these are lower, because a pregnant woman is already starting exercise at a higher resting heart rate. Now, we've also done some research where we can provide new target heart rate zones, and our PARMED-X potentially may be revised in the next couple years. But what we've done is we've reflected these new target heart rate zones in the DVD. So let me show you about these. So we did a study a number of years ago where we took a look at a fitness test with about 150 pregnant women, and we looked at women between the ages of 20 and 29 and 30 and 39 years. And what we did was we divided these women into the upper 25th percentile, so those very fit women, versus the lower 25th percentile, or those women who were not as fit. And what we did was, based on age now and fitness level, we can add to these target heart rate zones from the PARMED-X So if you have a woman who's 25 now that is extremely fit, very fit, she can now exercise at 145 to 160 beats per minute, which is slightly higher than what you see in the ParMed-X. And on the other side of that, an unfit woman who's never exercised before, the target heart rate can be a bit lower. So that's for someone who's 20 to 29 years of age and 30 to 39 years of age. And so now what we hope to see in the next couple years is these new target heart rate zones based on age and fitness levels. And so in the DVD, you will see reflected low, active, and fit. We've got 3 different intensities in the DVD. The pregnant woman can choose her fitness level, and she can choose her target heart rate zones based on age. So the new zones then are found in the Move for Two DVD. What about for those women who are overweight or obese coming into pregnancy? These particular target heart rate zones may not be appropriate for them. It might be very difficult for them to get and to work at that intensity. So we also have guidelines now for those women who are overweight and obese coming into pregnancy, and this is more like a walking program. So the current guidelines present target heart rate zones of about 60 to 80% of aerobic capacity, which might be a bit too difficult for those overweight and obese women to maintain. So the American College of Sports Medicine suggests that women that are overweight and obese exercise at a lower intensity. Again, they must be medically pre-screened, but now we've got published guidelines again for those women who are now overweight or obese, 20 to 29 years of age. This is the target heart rate zone for those women between 102 and 124 beats per minute. And 30 to 39 years of age, we suggest 101 to 120 beats per minute. And that is actually the target heart rate zones that we use for our overweight and obese pregnant women in our research study. And those women do very well. They improve their fitness, and they prevent excessive weight gain. So the second way, besides target heart rate, is something called Borg's Rating of Perceived Exertion Scale. And that is also on page 2, and it's on the very far right there. And it is basically what you do is you ask yourself or your pregnant client, how hard do you think you're working? And if she says between 11 or 12 to 14, somewhat hard, that is where she should be exercising. So between 12 and 14 is somewhat hard. So that is another way to check whether or not you are in the right intensity range. And the last way is the talk test. So that means that the exercise intensity is excessive if you cannot carry on a verbal conversation while exercising. So if you are really out of breath and you can't carry on a conversation, then you're exercising too strenuously and you need to reduce your intensity. Okay, so that's the third way to determine. If you are a pregnant woman and you don't have anybody to talk to, we usually suggest that you put your headphones on and you sing, or you dance, or whatever works. But where you can actually practice the talk test, either to yourself or to a buddy, or talk to someone else, where you can actually make sure that you are within the right intensity. I've had pregnant athletes come and talk to me. I have to tell you this story. She was a rower, intense. Came and talked to me about, can I continue my competition? Can I continue rowing? And I said, because I err on the side of caution, I would suggest that you do not do competition while you're pregnant. And I would also suggest that you stay within the target heart rate zones. She chose not to and was exercising very strenuously. And I found out later that she delivered a stillbirth baby at 7 months. So I tell that story because I don't know the answer to your question. But I would much rather err on the side of caution, and we know that these guidelines are safe, and then giving you the okay to go ahead and do that. Do you know what I mean? Like, I would much rather err on the side of caution. We have looked at fetal heart rate traces before and after exercise. No problem. As long as the women have been medically pre-screened and have no contraindications to being physically active, yeah. So I err on the side of caution. Any other questions? So time. Attempt 15 minutes, even if it means reducing the intensity. And that, again, for somebody that's just starting off, 15 minutes is a good thing. And what I usually suggest is they increase by 2 minutes every week until they reach 30 minutes, and then they can maintain that. But don't forget, you've got a 10 to 15 minute warm-up at the beginning of that, and a 10 to 15 minute cool down at the end of that. And so she actually may be exercising for 60 minutes, but she's at her target heart rate zone maximum of 30. So I think that's another important factor. So the rate of progression is, and again, this is on your page 2, right at the top there, it says rate of progression, that the best time to progress is during the second trimester, since the risks and discomforts of pregnancy are lowest at that time. And aerobic exercise should be increased gradually during second trimester from a minimum of 15 minutes per session, 3 times per week at the appropriate target heart rate, or RPE, or rating of perceived exertion, to a maximum of approximately 30 minutes per session 4 times per week at the appropriate target heart rate zone or rating of perceived exertion. So that just gives you an indication of how to progress. And again, it's important to listen to what your body is telling you. Type of activity, I've already mentioned that, so I'll just continue on to page 3. So, muscle conditioning is on page 3. So if you take a look at page 3, at the very top of the page, you can't see it on here, but it says, examples of muscle strengthening exercises, and I'm not even going to really touch on that, but I would like to talk to you about precautions about muscle conditioning. So, and then at the end of that page, there's a little scissor. You can see the little scissors. At the end of that page there is a medical pre-screening form that can be cut off, and the physician or the midwife can sign this, and it's to increase the communication between the pregnant woman, the physician or the midwife, and the fitness professional, so that the pregnant woman can take this document from her physician or midwife to the fitness professional so that they know that they've been medically screened. So, top of the page, examples of muscle strengthening. I'm not going to talk about those, but I do want to talk about each of these 5 precautions. The first one that you've got on your list here is body position. So, in the supine position, which is lying on the back, the enlarged uterus may either decrease the flow of blood returning from the lower half of the body as it presses on a major vein called the inferior vena cava, or it may decrease flow to a major artery called the abdominal aorta, which is the main blood supply to the uterus. So, we suggest a modification for any type of exercise lying on the back past 4 months of gestation or 16 weeks, that exercises normally done in the supine position should be altered. So you can still do abdominal exercise, just not lying flat on your back. So you can do curl-ups, or you can do side-lying, so you can do side-lying curl-ups. You just have to be a bit more creative, just not lying flat on your back. But you can also increase that incline to 45 degrees, and you will also get the same benefits. Again, we err on the side of caution because, let me show you, I have a little diagram to illustrate. So here we've got a pregnant woman standing. There's the pregnant uterus, and there's her inferior vena cava, no restriction of blood flow. But if you put her on her back and she's exercising, then you may potentially have an impingement here of the inferior vena cava, which you will get symptoms for. She will feel a bit lightheaded, but we don't have symptoms if she's also impinging on that abdominal aorta. There are no symptoms for that, so we err on the side of caution, and we suggest past 16 weeks, no exercise in the supine position. Second precaution, joint laxity. So there may be a possibility that ligaments become relaxed due to a hormone called relaxin. So a pregnant woman's joints may become a bit more susceptible to injury. So this is, again, avoid rapid changes in direction and bouncing during exercise. Stretching should be performed with controlled movements. So these are basically common sense type things, again, erring on the side of caution. Abdominal muscles, your third precaution that you've got there, there may actually be a presence of a condition called diastasis recti. And this can affect between 1 to 3% of pregnant women. We don't know why this happens, but what it is, it's the presence of a rippling or bulging of connective tissue along this midline of the pregnant abdomen, and it's seen during abdominal exercise. So what happens is my shirt kind of ripples like this, right straight along that midline. You will see it. I have seen a separation there of 4 finger breadths. So that has separated so much that I could stick my fingers in there. 4. So it doesn't happen very often, but when it does, it will be very noticeable. So if that condition does happen, we suggest abdominal exercise should not be performed, contraindicated, if this condition develops. And again, I've got a little cartoon to show you why. So here we've got these 2 muscle strips, the rectus abdominis muscle on both sides, and this linea alba or connective tissue line is right straight down the midline. So as the pregnant abdomen expands, you're going to get a stretching of those muscles, and if you continue to strengthen those muscles and the abdomen continues to expand, you're still going to get a tearing at the weakest point. And the weakest point is this connective tissue line. So if you continue to strengthen those abdominal muscles, you may actually make the condition worse. So again, we err on the side of caution, and we suggest that no abdominal exercise should be performed at all if this condition develops. Posture, number 4, our fourth. Posture on your page here. So pregnant women have terrible posture, and that's because they have an increased weight in the front part here. The enlarged breasts, enlarged uterus may cause a forward shift in the center of gravity. And it may, to compensate, you may end up with this lordosis at the back here. So you've got this kind of stick your bum out kind of thing. Bad posture, very bad posture. So what we suggest is something called a neutral pelvic alignment, and I'll show you how to get into that position in a second. But it's important that the pelvis remain in line, and that will also help with lower back pain. So this again is my little cartoon. So here we've got a pregnant woman who's standing with her weight, feet apart, weight balanced on both legs, and trying to keep the chin up, so we don't want to slump the shoulders. But be careful of something called the posterior pelvic tilt. And that is when she pushes her pelvis all the way forward. High repetitions and low weights. And that's probably about 12 to 15 repetitions with a comfortable weight. Be careful of holding your breath while working against a resistance, because it may change blood pressure and should be avoided. And also avoid exercise in the supine position past 16 weeks or 4 months of pregnancy. Okay? Yeah? So the idea here is not to bulk up. It is to maintain your strength or to slightly increase. Okay? So bottom of the page, as I've mentioned, is the health evaluation form. that increases the communication between the pregnant woman, the fitness professional, and the medical professional. And any questions on page 3? No? Page 4, moving right along here, page 4. The top of the page is advice from Health Canada, because they were also on board with this particular document. And the bottom of the page here, you'll see safety considerations and reasons to stop exercise and consult your healthcare provider. That is from Health Canada. Safety considerations, I'm not going to go over these tonight, but I do want to emphasize one of these. Know your limits. Pregnancy is not a good time to train for athletic competition. Reasons to consult your healthcare provider. If any of these things happen while you exercise, you stop immediately and you call your healthcare professional, midwife or physician. And that is also on page 4. Any questions about page 4? I'm going to summarize for you. So, summary of these PARMED-X Canadian guidelines. Previously sedentary women with healthy pregnancies can safely start a program in second trimester. Women with low risk pregnancies can continue mild to moderate activity throughout. Mild to moderate aerobic activity within the Canadian guidelines is considered safe, and muscle conditioning activity is also considered safe. I also just want to spend 2 minutes on fit pregnant women. Medical approval is essential. Must be a low-risk pregnancy. Check the history of their physical activity and their occupation. Use the PARMED-X and this new guideline for fit women that I was telling you about that is in the DVD. And preliminary research would suggest that pregnant women need longer warm-up and cool-down times, and that is also for the fit pregnant woman. Adequate nutrition and hydration is extremely important. Talk test is also good. And with very, very fit women that are used to running through pain, for example, it's extremely important that they listen to their body. Because now that they're pregnant, if they have a pain, they need to listen to why they have a pain. So it's very important for those fit women to really be in tune with their bodies. So how do we promote being physically active to pregnant women? It's a time when many women think about a healthier lifestyle. They improve their eating habits. They may not have eaten breakfast before, but now they do. They quit smoking, they stop alcohol use, they moderate caffeine consumption, and because they're thinking about being physically active, what a wonderful way to encourage them to also increase their physical activity. We did a study a while back where we asked pregnant women, what do you like doing? And walking was the most popular activity. And there are also barriers. And what they told us was having children and lack of time were barriers to being physically active. So, how do we incorporate and get over these barriers? And perhaps community programs which facilitate and encourage walking, because that's what pregnant women like doing. Maybe mall walking. How about walking in the mall? I know that they have elderly programs for mall walking. Why not combine the generations? It might be kind of fun, actually. And we could also overcome these barriers to exercise. We could include childcare or family walks. And these may be successful in promoting active living and physical activity during pregnancy. And if they can't get out, then of course, there are other ways to be physically active in their own home. For example, check out your cupboard. I love this because if you've got big cans of soup or tomato sauce in your cupboard, you can use those cans while you're watching TV. So you can do muscle conditioning activity using cans from your cupboard. No excuses, while you're reading a magazine or while you're watching TV. Other ways that you can be physically active: increase the number of steps that you take per day. Park farther away, take the stairs. I think the worst thing that people did in our city and in many cities is they put that parking right in front for pregnant women. I always tell my pregnant clients, pregnant women, to park the farthest away and take the most steps to get into the grocery store, because you want to increase the amount of steps that you take. Take the stairs, and actually wearing a pedometer is really great because you can see how many steps you've actually taken. So 10,000 steps a day is an active individual, and that also includes during pregnancy. Always use our DVD. So you can exercise in the privacy of your home, again funded by the Middlesex London Health Unit, and I just wanted to show you pictures of our crew. So this is Mottola and Judy. They were very pregnant when we did this, and this is our Spellbound production crew. And there's Mottola and Judy, and this is our fitness instructor that you'll see on the DVD. She just found out she was pregnant when we filmed it. So I can honestly say that all of our women that were in the DVD were actually pregnant, and they all delivered girls. Go figure that, hey? So if you do this DVD, you may actually have a girl. We'll see. So this just gives you the idea of, we filmed all of this in a day. It was filmed locally, local production company, and so we're very proud that the Middlesex London Health Unit was able to fund this production. So enjoy the DVD, and if you have any questions at all, feel free to contact either the Middlesex London Health Unit or myself. And the whole objective of this DVD is to provide safe exercise guidelines for pregnant women in the privacy of their own home. It's based on the PARMED-X. You will see that tool in your DVD. There's a chapter on, an expert chapter on pregnancy issues and safety considerations. So, yes, well, I had to get my 2 cents worth in. And we offer options for intensity, low, moderate, and higher options. Mottola, you'll notice, is doing the lower options. Our fitness instructor is doing the middle. And then Judy, in the DVD, is actually doing the higher intensity aerobic activities. The aerobic chapter is 15 minutes, starting at 15 minutes, building up to 30. So you can add 5 minutes each time you are feeling that you can. There's a warm-up chapter, an aerobic cool-down, muscle conditioning, and flex and stretch chapter. And I'm hoping that it's given to all the prenatal classes. This is awesome, for free. This is excellent. So to end up here, my job is to take a look at the confusing issue between pregnancy and exercise. So my job is to ask the research questions and to ask for volunteers who are willing to participate in research studies so that we can provide evidence-based guidelines to bring those guidelines into the community so that you folks can use these guidelines for a safe and healthy pregnancy. So can we restore this balance that I started off with? Of course we can. With healthy eating and physical activity, we can maintain this balance. And this is hard to see, but there's a little pregnant belly with running shoes on it, which is kind of cool. And I love this because I borrowed this from Ann Getty. So my motto is healthy mums equals healthy babies. And these are my 2 babies here. So my business is growing healthy babies. And so I think that if we take this information into the community, that we can pass this message on so that we can all grow healthy babies. Healthy mums equals healthy babies. And so my phone number is on there as well as my website. So if you have any questions at all, please feel free. And of course, I have to acknowledge our funding sources. I can't do this by myself. All the folks, co-investigators, students, this is our research team, and of course the funding sources. So thank you very much, and I'd be happy to answer any other questions that you have.